ICU X-rays, NG tube, CVC, T tube, NJ tube. What is it? Why is it used? Correct position, nasogastric tubes. A nasogastric tube, NG, is a flexible tube that can be inserted transnasally into the stomach. It is commonly used for delivery of feed, medications, fluids, or for drainage of gastric contents. In the event an NG aspirate cannot be obtained or the pH result is above 5, then the NG position must be confirmed via an X-ray. NG tube uses: administering nutrients and medication, removing liquids or air from the stomach, adding contrast to the stomach for X-rays, protecting the bowel after surgery or during bowel rest, delivering substances to your stomach. Correct position if NG tube. A central venous catheter, also known as a central line, C-line, central venous line, or central venous access catheter, is a catheter placed into a large vein. It is a form of venous access. Placement of larger catheters in more centrally located veins is often needed in critically ill patients or in those requiring prolonged intravenous therapies for more reliable vascular access. CVC indications: administration of vasopressors, chemotherapy, or total parenteral nutrition (TPN), extended course of intravenous IV antibiotics, support high volume flow for therapies such as hemodialysis, hemodynamic monitoring in critically ill patients. A lot of blood tests. Correct position if CVC. E-tube endotracheal tubes, ET tubes, are used to maintain an open airway in critically ill patients. The tip of an ET tube should be located in the trachea above the carina. A chest X-ray is often acquired following placement of an ET tube to determine the position of its tip. The trachea, carina, and main bronchi are almost always identifiable on a chest X-ray image, as long as the image is viewed on a high-quality screen in a darkened room. The correct position of an ET tube is 5 to 7 centimeters above the carina in adults. NJ tube. Jejunal tube feeding is the method of feeding directly into the small bowel. The feeding tube is passed by the nose into the esophagus, into the stomach, through the pylorus, and into the duodenum or jejunum. Indications for use. Some indications for use: absent gag reflex, severe gastroesophageal reflux, delayed gastric emptying, persistent vomiting. Correct position if NJ tube. Thank you.